Let us now go to epigastric pain. The topic is Diagnosis Part 2. For nausea and vomiting, if there's slight nausea, that's an indication of deficiency. If it's vomiting with loud sound, it's an indication of excess. Vomiting with low sound is deficiency, and vomiting soon after eating is excess. Vomiting sometime after eating is deficiency. Vomiting of food is excess. Vomiting of thin fluids is deficiency, and sour vomiting is invasion of stomach by liver, and vomiting of blood is an indication of heat. Distension, oppression, stuffiness, and fullness. These four sensations need to be differentiated clearly. A feeling of distension indicates stagnation of qi. This type of sensation will be seldom referred to as distension by Western patients. More often than not, patients will call it a feeling of bloating, bursting, being blown up, etc. The feeling of distension is subjective and objective, in that the practitioner can observe it and palpate it. On observation, the epigastrium is actually distended. On palpation, it feels distended like a balloon, hard but elastic. A feeling of oppression denotes phlegm or also more severe stagnation of qi. The translation of this term cannot adequately convey the image evoked by its Chinese character. This depicts a heart constrained by a door, and besides the physical sensation, it also implies a certain mental anguish associated with this feeling. The feeling of oppression is purely subjective, and nothing can be seen or palpated by the doctor. A feeling of stuffiness indicates stomach qi deficiency or stomach heat. Contrary to distension, which can be felt objectively on palpation, the sensation of stuffiness is only subjective and the abdomen feels soft on touch. A feeling of fullness indicates dampness or retention of food. A feeling of fullness is subjective, but also objective that it can be felt on palpation, but not on observation. On palpation, the abdomen feels hard. A feeling of an actual mass on palpation indicates stasis of blood. Palpation of the epigastrium reveals primarily the condition of the stomach and spleen. The normal epigastrium should feel elastic, but neither hard nor too soft. The area immediately below the xiphoid process reflects the condition of both the stomach and the heart and should feel relatively softer than the rest of the epigastrium. If this area feels hard on palpation, it often indicates stagnation of qi or blood of the heart, usually due to emotional problems. If the epigastrium feels hard on palpation, it indicates an excess condition of the stomach, which may be stagnation of qi, blood stasis, dampness, or retention of food. If the epigastrium feels distended like a drum, it indicates qi stagnation. If the patient has a subjective sensation of fullness but the epigastrium is soft on palpation, it indicates a condition of mixed deficiency and excess, often characterized by stomach heat and spleen qi deficiency. If palpation of the epigastrium relieves the patient's discomfort, it indicates a deficiency condition of the stomach. Thank you so much for your attention.